I'm Shelley Meyer, and I chose the article, The Influence of Prenatal Exercise on Offspring. As far as the relevance for this article in health promotion and even just the interest for me and why I selected this article is that I have been pregnant or nursing for the past 7 years in my life. So I've actually done a little bit of research on different articles that are out there with exercise during pregnancy and so forth. And so it's just been very applicable to me and very relevant for me in my current stage. But it has lots of good information that can be shared with any woman who is pregnant, and just encouraging for those folks to be exercising during their pregnancy, not only for them but for the benefits that it would have for their offspring. When you read through this article, there at the beginning, it just kind of begins by noting the large number of overweight and obese children, which that also tends to lead to other health issues for those folks later in life that could go towards diabetes or even cardiovascular diseases. The article then goes on to discuss the benefits of exercise during pregnancy, which can help decrease obesity. And then, of course, it mentions several other benefits to exercise for women during pregnancy. It lists there that women who exercise throughout gestation show significantly decreased risk of preeclampsia, hypertension, gestational diabetes, weight gain, the rate of spontaneous abortion, congenital abnormalities, the incidence of preterm labor, and offspring tend to have normal growth and development. The developmental origin hypothesis is listed next, kind of in the introduction of this article, and basically it's just talking about the utero environmental influences that helps program fetal organ development and the implications for the infant after they're born and even going into adulthood. So since there is supporting evidence of maternal exercise for the offspring, this particular article just kind of looks at what those benefits are. In other words, does a pregnant mother who exercises help lower the risk of diabetes and heart disease for her child, and does that decreased risk carry for that child even into adulthood? The authors of this particular article, they use a plethora of lots of other articles and studies and research to kind of collaborate their reports and findings, and this is all done through quantitative resources and research. So what sort of exercises should a pregnant woman be participating in? As long as they are not being told differently from a doctor due to some sort of underlying condition, this article supports that exercising of multiple types were all found to have relatively the same positive impact, regardless of that level of intensity or regardless of being aerobic versus resistant exercises. So basically, to all you pregnant mamas out there, just find what you like and get moving. This article also references studies that were done on low-income minorities. And while they found that folks of lower economic status and maybe some with of different minority groups were sometimes less likely to seek out prenatal care services, they are often getting the necessary exercises that they need to benefit during pregnancy just through their work, whether that be walking or climbing stairs. Moving on into the article, we see a section on birth measurements. And so in looking at that, the authors focused on studies that used exercise throughout pregnancy at the current recommended levels, which directed them to 6 different studies. And they kind of summarized those studies, but overall those findings suggest that birth weight may be normalized by exercise during pregnancy. And the authors also looked at 2 population-based cohort studies, which suggest that birth weight is determined mainly by non-exercise variables. So kind of a couple different contradicting findings there. Some of the non-exercise variables listed here that a couple of the articles that they researched suggested that maybe birth weight was more indicative of maternal body composition, diet, utero-placental blood flow, placental transfer of nutrients, and fetal genetics, with the influence of maternal exercise actually being pretty minimal on the birth weight. Body circumference at birth can also be utilized as an indicator of fetal growth during gestation. And overall, the data suggests that maternal exercise does not adversely influence offspring growth measures. The last half of this article really focuses on the data that was collaborated on postnatal measurements, which for me was a little more interesting to kind of find out about, just figuring out how me exercising during pregnancy may or may not affect my children as they grow after birth and into adulthood. And here it talks about the studies that currently are underway regarding that continued growth and development of children who are exposed to exercise in utero. And here, starting with the 1 year age range, they really found no significant difference in growth measurements, and that was determined by their height, their weight, head, chest, and abdominal circumferences between the children who were exposed to exercise when in utero versus the children born from mothers who did not exercise. So not a huge difference in the actual growth measures. And even when they looked at children who were 5 years old, looking at those same growth measures, not a huge difference between the two groups. However, what they did find was that the children exposed to exercise in utero tend to weigh less and tend to have less fat mass as compared to those children who were born from women who did not exercise while pregnant. Therefore, those findings support the idea that pre-pubertal body morphometric measures, that's a mouthful, are programmed in utero. Next, the authors talk about their observations with the research dealing with heart rate findings. Children exposed to exercise in utero exhibited no evidence of cardiovascular disease into adulthood. So this persistence of a healthy heart, measures of offspring through childhood and even into adulthood, just supports that whole premise of prenatal programming. Moving on through the article, looking at studies with neuromotor, cognition, and intelligence, the findings were very interesting. Referencing this table 1 that's listed down there in the article, we can see that children who came from mothers who exercised during pregnancy had statistically significant increases in their neurodevelopment measures when compared to those children who were born from mothers that did not exercise during pregnancy. And they kind of divided these into several different age categories. We see the significant changes for the age groups of 5 days old, for children for 8 to 12 days old, children who were 1, 2, and 4-year-olds, a 5-year-old category, the 8 to 12-year-olds, and the 17 to 20-year-olds. And lastly, the article uses gestational diabetes research and just kind of talks about how gestational diabetes can cause lots of health issues and concerns for the pregnant mother, which are listed throughout this last little article piece. But then even further, it suggests that gestational diabetes could affect the intrauterine environment, which increases the genetic risk of developing childhood obesity and or even type 2 diabetes for that child as they go into adulthood. And this article goes on to say that physical activity during pregnancy, however, can help decrease that risk of gestational diabetes, in part by decreasing the excessive gestational weight gain and stimulating a better control of glucose metabolism. So in conclusion, and just to kind of recap the relevance of this article, with health promotion, does a really nice job just presenting a lot of information that's super supportive of why mothers should exercise during pregnancy and the benefits that that has on their children. And I know for me and any of you who have maybe been through pregnancies, you've dealt with the nausea and the exhaustion and all that fun pregnancy stuff. But this article and the data that it presents really just maybe provides that extra motivation for us to go ahead and suffer through those weeks of exercising through that pregnancy. Blah. Just knowing that we are hopefully providing a lifetime of extra health benefits for our little ones.